overall, South Korea has done 5 times more tests than the U.S. per capita. Why is that?
I don't think that's true.
That is true. And you said this morning that the White House said the U.S. passes South Korea in virus testing.
Who are you with?
Yahoo News. And it's not true per capita.
Do you want to respond to that? If you have the numbers.
Sure, I have the numbers. So remember early on, we pushed tests to the outbreak areas, just like he described. His primary outbreak was in Miami-Dade and Broward County and Palm Beach, so they pushed tests into that region. We did the same thing in the United States. So if you look at every single state that had an outbreak, their testing is greater than anywhere in the world. They're in the 42 per thousand range.
Your point is taken about individual areas, but overall, we've had 14 times more infections than South Korea. So are we doing something wrong, and why is that? They have a very dense population.
Yeah, our epidemic looks much more like the European epidemic. So right now, we're tracking very close to the countries in Europe, and we're testing at their rate of their concentrated epidemics and where they're occurring in the metros. I think it really shows the susceptibility of our major cities in the same way they were susceptible in Europe. And so we've been very focused on that. That's not to say that we're not supporting the rural states. We're very much supporting the rural states and very much supporting their testing. There's no state right now in the United States that's tested really less than 1%, which is pretty remarkable when they don't really have significant cases. But we've been really working with states to do sentinel surveillance and also to reach out to our Native American populations as well as our inner city. So I think now that we've expanded testing dramatically and CDC has altered the criteria for testing, I think you'll see as governors have unlocked more and more potential in their laboratories. We know that we have more laboratory capacity, and you hear the governors talk about we have capacity and now we have to match things, the resources that you need, the swabs and the extraction media with the capacity. And I think governors are well aware of how to expand testing now.
Why not then require that people take tests before they take international flights, and why not even require that people wear masks on planes?
We're looking at that, and we're probably going to be doing that. Brazil has pretty much of an outbreak, as you know. They also went a different way than other countries in South America. If you look at the chart, you'll see what happened, unfortunately, to Brazil. So we're looking at it very closely, and we're in coordination with other governors also, but in particular with Ron. We'll make that decision pretty soon.
But what about all flights, all international flights?
Well, we're looking at that. That's a very big thing to do. Again,
So
I did it with China, I did it with Europe. That's a very big thing to do. It's certainly a very big thing to do to Florida because you have so much business from South America. So we'll be looking at that.
So to our Yahoo gentlemen, I just want to make it clear that South Korea's testing was 11 per 100,000, and we're at 17 per 100,000.
All right.
So
Are you going to apologize, Yahoo? That's why you're Yahoo, and nobody knows who the hell you are. Go ahead, let's go,
Based on the
Jeff.
numbers
Go
I've
ahead.
seen,
that's why nobody knows who you are, including me. Go ahead.
Mr. President,
just check it again.
You ought to get your facts right before you.
Well, we have
make a
had
statement like
14
that. Okay,
times
well, your
the
facts are
infection.
wrong. Let's go.
Governor DeSantis, you did face quite a bit of criticism for not closing your state as soon as some did. There's a lot of
Look at
attention.
what have the results been. You look at some of the most draconian orders that have been issued in some of these states and compare Florida in terms of our hospitalizations per 100,000, in terms of our fatalities per 100,000. I mean, you go from DC, Maryland, New Jersey, New York, Connecticut, Massachusetts, Michigan, Indiana, Ohio, Illinois, you name it, Florida's done better. And I'm not criticizing those states, but everyone in the media was saying Florida was going to be like New York or Italy. And that has not happened because we understood we have a big diverse state. We understood the outbreak was not uniform throughout the state, and we had a tailored and measured approach that not only helped our numbers be way below what anyone predicted, but also did less damage to our state going forward. I had construction going on, the road projects, but we did it in a safe way, and we did it, I think, in a way that is probably more sustainable over the long term. So I think people can go back and look at all the criticism and then look now, and nobody predicted that Florida would. We have challenges. This is not an easy situation. We've had people in the hospital, but I am now in a situation where I have less than 500 people at a state of 22 million on ventilators as of last night, and I have 6,500 ventilators that are sitting idle, unused throughout the state of Florida.
So
Interesting. You talk about ventilators, and ventilators were going to be a disaster in Florida, a disaster. There's not enough, and we sent them thousands of ventilators, but in the meantime, you have thousands of ventilators that aren't used, and We'll be able to send them probably to other countries. You'll build up your stockpile, but we'll be able, because other countries, Italy, France, numerous, Spain is very much, we're sending to Spain. I spoke today to Nigeria. They'll do anything for ventilators. We're going to send at least 200 ventilators to Nigeria, probably more than that. So, but ventilators was going to be a big problem, and now we have really, through an incredible amount of work by the federal government, we have a big, beautiful overcapacity. And it's the same thing with testing. The only problem is the press doesn't give credit for that, because, no matter what test you do, they'll say, oh, you should have done this. You should have tested 325 million people 37 times. Now, the testing is going very well, but this is a good example of a partnership between the federal government and a state government. Ron has been great, and some of your friends, some of the other governors have done a good job, and some haven't done a very good job, I'll be honest with you. Some have not.
But one of the things I think, Jared, he had a team of going about, like, figuring out where the ventilators would be needed. So when everyone was talking about 40,000 ventilators in New York, I'm in contact with Jared about Florida, about New York, and he was saying, well, they're not gonna need that. And I was like, look, I agree with your numbers. I don't think we need any ventilators in Florida right now. Maybe things will change. So they were ready at a moment's notice to get the ventilators wherever they need. We never got, I think we may have just gotten 100 at the beginning from FEMA, but we never got like an emergency shipment because we didn't need it. But they were absolutely ready, willing, and able to do that once the data suggested
They were on
needed
call. A lot of people expected it. When we read reports from the papers, I'd call Ron and say, Ron, I think we're gonna need maybe thousands based on what some phony news organization was saying. And more and more, number one, it was well handled, but we were ready to move, and we still are. We have more than 10,000. Jared, what do we have, 10,000? More than 10,000 in stockpile.
More than 10,000, and it's growing every day. We're getting a lot more in than we're sending out.
And what we'll be able to do is help other countries, which is a good thing.
We solved that issue right now.
Can you clarify what your intelligence advisors were telling you back in January and February? Were you warned about what was happening with coronavirus and the threat to this country? Should there have been stronger warnings?
No,
What were you hearing every day in your
I think probably
daily
a lot
brief?
more than the Democrats, because a month later, Nancy Pelosi was saying, let's dance in the streets of Chinatown. You go back and you take a look at even professionals like Anthony was saying, this is no problem. This is late in February. This is no problem. This is going to blow over. And they're professionals, and they're good professionals. Most people thought this was going to blow over, and you can go. We did, I think, on January, toward the end of January, we did a ban with China. That was a very, I think you just said a little while ago, that was a very important step. And then ultimately we did a ban on Europe. That was very early in the process, because if you take the ban and you look at it, I was badly criticized by Sleepy Joe Biden, by others. I was criticized horribly. He said all sorts of things. We won't even say it. And then he apologized, because 2 weeks ago he put out a statement that I was right.
So
we did a ban, John, as you know, we did a ban, and many people, Democrats, professionals, probably Republicans, said that this would never happen, there'd be nothing, no big problem. You saw that, I think, better than anybody, Deborah. This was after the ban, so obviously I took it very serious. I'm not going to be banning China from coming in if I didn't take it seriously, and I did that early.
So were you getting warnings in your presidential daily brief?
I'd have to check.
About...
I would have to check. I want to look as to the exact dates of warnings. But I can tell you this: when I did the ban on China, almost everybody was against me, including Republicans. They thought it was far too harsh, that it wasn't necessary. Professionals, Republicans, and Democrats, almost everybody disagreed, and that was done very early. And that was a big step, because I think we saved, whether it was luck, talent, or something else, we saved many thousands of lives. And Anthony said that, and you were saying that, and a lot of people said it was I think you'd have a much different situation right now if we didn't do the ban.
On that,
we also did a ban, as you know, earlier. We did a ban on Europe sometime after, but still relatively early.
Now, after the ban on travel from China, 40,000 people came into the United States. Those were American citizens largely. In hindsight, looking back, Should there have been steps made to quarantine those people that were coming back or to test
Well,
them?
there were,
or-
because in Florida, we had hundreds of people that were under investigation by our health department. They were asked to quarantine for 14 days. Anyone that was coming back from China, the Wuhan area and Hubei province, they were having to self-isolate before they could even get to Florida, because that's what you guys did.
Right.
But we had all hundreds of people under investigation during this time, and actually none of them ended up testing positive, the ones that developed symptoms. I don't think a lot of them didn't develop symptoms, but that was actually being done in Florida, and we were very much viewing it as a China deal. Of course, I think it was, New York eventually brought it to Florida, but that was being done in the state level.
And the people we let back, John, as you know, they were American citizens. What are you going to do? You can't come back into your country. It wasn't like we were thrilled either. I said, well, we have these people coming back. All American citizens, meaning just about all American citizens, there's not much you can do about that.
That's
Now,
right.
we did do
In
testing,
hindsight, would
and
you have-
in hindsight, the states did testing. I know Ron was doing a lot of testing, and the individual states were doing in cooperation with the federal government. But originally it was that, 40,000 people came in. What they don't say, what the news doesn't say, is they happen to be American citizens. How do you keep American citizens? You say they're coming in from China, they want to come back to their country. There's a tremendous problem in China. They want to come back. Are we supposed to say to an American citizen, you can't come back into your country? And we did do testing, and individual states did testing, or were supposed to have. Anybody else? Yeah.
Mr. President?
Mr. President, on the food supply chain,
Yeah.
is there anything your administration is doing or might be doing in the future to make sure that there's enough meat supplies?
Yeah, we're working
should we
with
ban
Tyson.
exports of
We are.
pork
We're going to sign an
to
executive order today, I believe, and that'll solve any liability problems where they had certain liability problems, and we'll be in very good shape. We're working with Tyson, which is one of the big companies in that world, and we always work with the farmers. There's plenty of supply. There's plenty of, as you know, there's plenty of supply. It's distribution, and we will probably have that today solved. It was a very unique circumstance because of liability. Yes,
Mr. President, some more details on the executive order regarding the meat supply. So it seems like the issue right now is that with the processing plants closed down, there are all these animals, but they can't be processed into meat to hit American
Yeah, we're
supermarket shelves.
handling it. Probably today we'll have that, it's a roadblock. It's sort of a legal roadblock more than anything else. We'll have that done today. You could speak to the chief in a little while if you'd like, okay? They'll give you a specific, I don't know if you'd like that because there won't be any cameras running, but if you'd like to get a real answer, you could speak to the chief.